How is childhood cancer different from cancer in adults? So children, neither do they smoke, they don't take alcohol, their food is usually clean. Despite that, children can get cancers. This is because of gene mutations or genetic mutations. This does not mean hereditary. So there are certain gene mutations that happen for reasons unknown to us, but we know that these genetic mutations or gene mutations can lead to cancer in children. Apart from this, there are certain syndromes like Down syndrome, Fanconi, Bloom syndrome. All of these also put children at a higher risk for cancers. How do we differentiate cancer in children from adults? The treatment aspect is one big difference. Our cancers in adults more often seen in stomach cancer, breast cancer, lung cancer, whereas cancers in children tend to be leukemia, which is blood cancer, lymphoma, or brain tumors, which is brain cancer. Other than this, other common tumors in children tends to be Wilms tumor, neuroblastoma, and bone tumors. So if you look at the variety or the type of cancers itself, it's different between children and adults. Hence, the treatment also varies quite a bit. So cancers in children are highly responsive to chemotherapy, unlike cancers in adults, and require quite a few sessions of chemotherapy. The other advantage is children, since they have healthy organs otherwise, can tolerate higher doses of chemotherapy and also undergo bone marrow transplantation with very few or limited side effects, as opposed to adults whose organs, especially if they have been detected with cancer after the age of 50s or 60s, are not able to tolerate higher dose chemotherapy and would be at high risk for organ toxicity and may not be able to tolerate high-end procedures like bone marrow transplantation. Because of all these factors, the cancers in children are far more curable compared to cancers in adults. But remember, it has to be treated at the right center by appropriately trained person to give the child the best chance at life.